Hi, Dr. Garima here again, and we'll be solving another question for the Australian Dental Council exam. Uh, Today's video is probably, uh, yeah, I mean, this is last video for this particular 10 days because I'm traveling, and that itself is taking a toll on me. uh, yeah, I'm traveling to Bombay tomorrow and traveling with a toddler. So I'm just hoping everything goes well in the aeroplane. Because though he's a very well behaved child, but then he's a child. And the last time when I traveled with him in the aeroplane at the end of our trip, as in he just could manage to enjoy himself for like 1.5, 2 hours, but the last 30 minutes he was really getting bored and he was like, now I have to get down and I have to explore the aircraft. And those air hostesses were serving tea and coffee and they had like hot water. So I was so scared that he should not go and bump into them. So I was trying whatever I could to, just standing sidewise here or there. And then he further got bored, and so what he started doing was he started taking bottles of water which I kept taking their caps and just like throwing it away, so it would go and randomly fall in anybody's head or lap. I mean, you really cannot control this scenario, can you? So I just hope somehow it goes smooth and nobody's head or something gets, troubled by him. So yeah, it's exhausting, but yeah, it is what it is. I mean, see, I'm very happy and I'm blessed that I have my toddler. But then I do miss some days where I had traveled all by myself in absolute zen peace, watching something of my liking, just relaxing, and getting pampered. But now I'm just 24/7 focused on him when I'm out with him. But yeah, it is what it is. So, anyways, while I'll be in Bombay, I'm attending my cousin's wedding, so I really won't have time to shoot any video. Plus, I'm not carrying my laptop. So, yeah, this is one of those videos, and the next video probably I'll shoot once I'm back and settled back because a lot of appointments would be there when I'm back, as I'm not there for a week, so it gets choco block when I return. So, probably my next video would be coming after 19th or 20th of December. So yeah, like almost 14 days from now on. So let me quickly shoot this video and get on with it. Very good question. This is a medical related question, and definitely one of such questions will be asked to you in your exam, which is related to bleeding disorders. You yourself will face such situations in life, and being a pediatric dentist, I myself faced many such situations in children who had congenital hemophilias, thalassemias, even major thalassemias, vitamin K deficiencies, and then we had protein S and protein C deficiencies, and we have Crigler-Najjar syndrome, where liver wasn't functioning well. So again, there was clotting factor deficiencies. So many such cases, and especially the hemophilia cases are very difficult to manage because you just cannot give any block. You should not give any alveolar blocks because it can be dissecting hematomas that can occur if you accidentally injure the artery or something, and it would just fail to clot unless the clotting factor is properly managed. And thalassemia major patients, you have to treat those patients like just the next day after the blood transfusion so that everything is appropriate, because they need blood transfusion every 21 days, and the more they are towards their transfusing stage, the lesser the clotting factors they have. So yeah, many things to manage. Bleeding disorders is one thing which you should be prepared to handle at any point of time, and you should absolutely be aware of what all things are needed to handle it. So yeah, let's go with the question. A 50-year-old patient, 50 like half century, quite mature patient, I would say, presents to your clinic for an extraction of a badly broken down lower molar, and some similar picture was there in the exam, like very bad tooth basically. She owns a cafe and does not have time for lengthy treatments, so quick fix. She has been on Warfarin for 10 years for deep vein thrombosis. Deep vein thrombosis, read more about it if you don't know. Just a brief, in your legs, there are many deep veins, and thrombosis of this meaning, especially the sedentary lifestyle, or as you age for some reason, a thrombus can develop which can become an embolus, and that would directly go and lodge in your pulmonary artery or somewhere and cause like severe infarction or something. So it's a very deadly and dangerous, life-threatening condition. So whenever you see some things like these happening, then the patient has to be on blood thinners, and it's already mentioned that she's been on Warfarin for 10 years. Warfarin is a vitamin K antagonist. Vitamin K is a clotting factor which is produced by the body, which initiates the clotting mechanisms, and Warfarin counteracts it basically. Clotting mechanisms are one of the defense mechanisms of the body. Whenever they encounter something which is not natural, and basically a severance, or even for example plaque situations, which is not normally found in the arteries, then the body kind of detects that there is some problem and it starts to clot in that area in order to heal that area off, basically preventing further damage. But in some situations it works against the body, because certain conditions in the body mimics as if some damage has happened when it's actually not, and the body tries to clot that area. But then in doing so, it damages various other parts of the body, because once there is a clot, blood cannot flow in that area, and you definitely don't want a clot in the pipes which actually allow the blood flow, correct? So so vitamin K is a very important factor, but then when it becomes detrimental for the body, then in order to save the life, you have to give an antagonist, and Warfarin is that. So when you give Warfarin, basically the blood does not clot that fast. It clots. It's not like it wouldn't clot. It clots, but not that fast, meaning the bleeding time is delayed, meaning there's a lot of blood loss if any injury were to happen. Extraction is kind of you injuring the tissue to remove the tooth. Of course, removal of tooth is necessary in this scenario, but at the same time, when you remove it, you are inducing bleeding from the gums, because you're practically snatching the tooth out of the body, and that bleeding has to stop. Now, if the bleeding won't stop, then it's another problem, because the blood will keep oozing out, and you don't want loss of blood, and that would create multiple problems, you understand? So you want the blood to clot. So you need to know exactly what is the status of the clotting factors in the patient. Now, if the patient says, I'm having warfarin since the last 10 years, that means it's very, very important that for his life, warfarin continues. So now you have to manage this condition with a bleeding disorder. You understand? She looks anxious due to her work commitments. Okay, she's also anxious. Fair enough. Now, the most important factor to be considered before commencing the extraction is most important. Most is the keyword here. If I remove most, then the important factor to be considered here is, that means, but if I've given this word most, it means all the options given would be correct. All of them are important. Now I have to choose the most important. For me, the most important is the life of this patient and nothing else. Okay. So administer antibiotics. Okay. Seize warfarin 24 hours before the procedure. See, you are a dentist. You are not the physician for the patient. You don't know the entire medical history of her. And whenever any medicine that you have to prescribe is out of scope of your dental treatments, and usually dentally related medicines are just painkillers, antibiotics, in certain scenarios some steroids. We never prescribe any medicines for blood pressure, for diabetes, for bleeding disorders, or anything that is related to any other systemic portion. We are just strictly restricted to the dental part of the thing, including infections, and that's why the antibiotic comes into picture. So whenever a patient is having some medicine which you have not prescribed and it's prescribed by the GP, you will not take a decision to stop it at all. You will always consult the GP and you will ask the GP to stop it, or can it be stopped, because the GP is actually taking care of the full life of the patient. You are just taking care of the dental part, and just you want to perform something on the dental part, you cannot risk the life of the patient. Okay. So seize warfarin 24 hours before the procedure, it's absolutely wrong. check pulse and blood pressure. Yes, you should check that irrespective. Take a detailed medical history and consult an oral surgeon. Consulting an oral surgeon is not wrong, but if it's a simple tooth for extraction, there is no point consulting an oral surgeon. If it was consulting the GP, I would prefer that option instead. But since that option is not there, I'm going to take a detailed medical history. Because whenever a patient is taking one medicine, it may happen that they are taking other medications as well. And plus, we also want to inquire about the general health of the patient as to what is happening, because they are taking some medication which is preventing life-threatening damage. So is there anything more to it that you should be knowing about it? So a detailed medical history becomes very, very important. If there was an option, consult the GP, I would choose that option, and then I would choose take a detailed medical history. Administer antibiotics is not correct at the moment. It is important, but not that important as much as the detailed medical history. You understand? So most important factor would be take a detailed medical history. Now, blood test for INR should be undertaken. I would prefer immediately before the surgery, but the guidelines say within 24 hours. So I will follow the guidelines, not what I prefer, right? So the answer becomes within 24 hours before the surgery, not 48 or 72 hours. It's 24 hours before the surgery. These are the guidelines, stick to the guidelines. Now, if the INR is between 2.3 to 3.5, what would you do? INR is internationalized normal ratio. They check a ratio of two clotting factors together. I think I've discussed this in another of my video, but anyways, the normal ratio for a normal person without any problems is 1. Okay, just remember this, it's 1. Anything more than that means there is some problem going on, and you should be prepared depending on the score that you get of the hemostatic measures that you are about to take. Now, when it is 2 to 3.5, it can be considered normal if the patient is on Warfarin. Because anyways, because the patient is on Warfarin, the bleeding time would be delayed because clotting is going to take some time. So, for Warfarin patients, up to 3.5, if you get that reading, is acceptable. But if it was say 5 or 6, then that is not acceptable. It means the Warfarin is not working that much that it should have been. And further hemostatic agents become necessary to be applied, or probably you have to do such a treatment in a hospital session with infusion of some clotting factors. But because it falls in the range, for patients who are on Warfarin, you can proceed with surgery using homeostatic measures like suture and gelatin. Proceed with surgery using antibiotics and tranexamic acid mouthwash. Well, if it was just tranexamic acid mouthwash, I might have considered it, but I don't have to use antibiotics unless there is an infection, and there is no infection. So I do not want to give antibiotics. That's why I'm not choosing option B. Option D is absolutely wrong. You cannot stop Warfarin. Refer to patient's GP for what? The GP is not going to extract. Proceed with the surgery as if the patient is normal. No. If the ratio was 1, if they would have mentioned if the INR is 1, then I would have chosen option A directly. But because it is not, and I have it on a higher side, but because the patient is on Warfarin, it's normal for the Warfarin taking patients, not for the normal patients. In a normal patient, without any medication, if it would have been 2 to 3.5, then I would refer the patient to the GP to see what's happening, why the ratio is more. There has to be some underlying conditions. And once that underlying condition is diagnosed, then only I would go ahead with extraction using, again, homeostatic measures, suture and gelatin. You're understanding what I'm saying? McDonald's, Dean and Avery is a very nice book for pedo, and they have beautifully explained all the medical bleeding disorders in it for children perspective, but you can of course apply the same on adults. And of course there are numerous medical emergencies in dentistry textbooks. Please go through them. You may just encounter few patients in 1 year in your clinical practice, but then those few patients should not give you stress while handling, because it's your confidence that is going to give the patient the confidence to come to you. There are risky cases and you should be confident in managing them. You are their doctor after all, so you should be confident, and confidence will only come with the right amount of knowledge. I really like such questions when they come in the exam because it tests your skills, and it's okay if you're not that confident. Pause the video, go open those textbooks, spend today's entire day in reading that textbook. Imagine the scenario if a patient comes for any specific disorder, hemophilia, thalassemia, what questions would you be asking? Consult the patient's GP if you have to, to understand what all things you should be taken care of. Talk to your friends, talk to your colleagues, talk to other professionals. They would be happy to help. Do this and be confident, okay? Now, the action of warfarin is, what does it do? I think I said this while I was reading out the question. It antagonizes vitamin K in the body. It does not decrease production of platelet. It's not antiplatelet. Prevents platelet aggregation? No. Increases platelet adhesion? No. Increases the production of vitamin K in the body? No. It just antagonizes vitamin K. Now again, I've given out the answer here, but I would like you to again pause this video, go to some other YouTube channel and type how does warfarin works. You may memorize the answer out here, but it's always better to exactly understand the physiologic nature of how the clotting system works. Do you remember your first year physiology? We used to draw those cascades, the extrinsic clotting cascade, the intrinsic cascade, and those factors 7, 10, 11, 12, etc., which activates when. Go to that, read about it. That time we memorized to pass the exam, but now you have the time. Now actually passionately study how it actually works, which medicine targets which factor, and how targeting that factor stops whatever has to be stopped. So read more about it. That time, well, I was in my first year BDS in 2003, 4, I guess, yeah. I mean, Gmail and Google and all stuff was just recently introduced, I guess. And I mean, I didn't have a computer. I did not know YouTube at that time. I did not have those many videos to check as much as I have now. So you have the advantage, but now just go ahead, like watch it. And so many people have made such beautiful animated videos just to, imbibe all that information in your brain. I had to imagine those things. But anyways, now that since it's available, get the passion inside you to know more about how it works. See, not only are you going to clear the exam when you learn all these things, at some stage, you may have a student like you who will come to you with, asking for guidance. You have to also guide them. That is also part of your responsibility. It's not just to study, earn money, and that's it, You have to give back at some point of time, and you need to have something to give back to and make it as interesting and not boring, while you're giving back the information. You also should make sure that whenever you're talking about your subject, you're very passionate about it, because that is what is going to inspire the other people who are looking up to you to have passion for their field, because that is how we are going to keep serving humanity, right? That's the greater purpose. The smaller purpose is to, have enough money just for us to survive in this world. But the greater purpose is actually to keep the nobility of the profession alive, and passion has to be there for it. So read more. When you know more, you can explain better. The patient is not happy to do a blood test and insists that her GP told her she can have any dental treatment. What do you have to do? Never believe any patient. Never ever believe any patient's words, okay? Stick to the protocols that have been given to you. But you have to also respect the patient's wishes. But you have to make sure that you're not putting the patient at risk, because the patient wants something to be done for her desires. Because after all, when you start a treatment on the patient's body, you'll be responsible for it. So even though the patient is not happy to do it and insists that the GP told her, tell her very politely that I'll talk to your GP. If she gives me a written consent that she's fully aware of your blood stats, then I'll go ahead with the procedure, because the patient is going to the GP regularly. Maybe the GP has her latest blood test done. you may never know what is the track record of her with the GP. Maybe the GP would say, no, you have to do the blood test, etc. Anything can come out of it. So contact her GP before commencing the treatment. Listen to the patient's desire and comments the treatment is wrong. Trust your patient words and comments. Never ever trust patient's words. Mark my words, never do that, no matter even if they are closest relatives. Treat them like a patient. Dismiss the patient and insist on the necessity of the INR test before the procedure. Option C is too harsh, though it's not wrong. As much as you would want the test report to be handed over to your hand yourself, dismissing the patient is not right, because you have to somewhere respect the patient's wishes as well. So if she's introducing her GP in the scenario, well, go talk to the GP so that the patient also feels that you have heard her. And because she's willing to listen to her GP more than you, if the GP tells her to get the blood test done, she'll get it done, and ultimately you are going to do the extraction. So I hope you have understood many things from this question: professionalism, how to handle medical emergencies, bleeding disorders. I really like this question. Read a lot about medical emergencies today. All right. So yes, that's about it, and hopefully I'll see you in 14 days back in the same room. Traveling to Bombay, I'm going after almost 6-7 months, and just for a week. Mixed emotions. It was a difficult time when I left Bombay almost 9 years ago. I had so many memories attached there. I never thought actually I would be leaving Bombay ever. I love the city and I had my own clinical practice. But I had some personal, very bad relationship breakup. And I just could not take it because I had given my heart and soul, and I just could not bear the thought at that time that I would stay in the same city where my ex lives, and it was quite painful at that time. So I thought, let me move somewhere else, and I think that was one of the main reasons that made me come to Dubai. And I've been grateful to God and thankful because Dubai has blessed me with so many things and helped me forget that phase of life. I was just very young at that point of time to really be worldly wise, like raised in a very conservative family. Never thought what happened would happen, but people are people. Yes, it did break me a lot at that point because I loved my home, I loved my parents so much. I never thought actually of leaving anything. Like, whole my life I had stayed in Bombay and developed a beautiful practice there, but sometimes deep inside you, when you're not at peace, you just want to run away. And I came to Dubai all by myself because it was too much painful out there to stay anymore. So anyways, going back to the same city, but now I'm over it. It's been like 9-10 years now, and I'm settled, and I've pretty much forgotten about that phase of my life. Maybe God wanted it this way. Maybe God wanted me to treat global population, global children instead of just Indian children. and I've had amazing experiences here, like communicating with so many kids from different nationalities. Like, wow, over 60-70 different nationalities I must have treated by now, and getting insights into their culture, which obviously I wouldn't have been able to in Bombay. Like, professionally blessed. And personally I think it was a journey. You sometimes have to dive deeper inside you whenever you go through a lot of pain and heartbreaks, I guess, and you become more empathetic, more kinder. Like, I aged quite a lot in those young years of mine. Like, I was just 23 or 24 at that time. First experience, So I think the pain that you go through like ages you emotionally quite a lot, like which of course helped me a lot in understanding many aspects of life. At that time it was just killing me inside, but But yeah, eventually I think you do mature and a different part of your personality develops. So, anyways, so yeah, going back to Bombay is always mixed emotions. But it's okay, I guess. This time I want my son to enjoy because this would be his first wedding to be, I mean, to attend basically, and he's a bit manageable now. He'll be turning 3 this January. Oh my god, 2nd January is his birthday, and what a journey it has been last 3 years, like so many ups and downs. Someday I'll make a video about that too because he was born premature by 3 months, and that was another difficult journey with him. But by he's God's child, you know. God's blessed him, and by God's grace, he's been fine. So yeah, he'll be like finishing his 3 years this 2nd January. So it's a little manageable now. Like he talks a lot. So he speaks a lot. He orders practically. He calls the shots at home nowadays. So yeah, let's see how it goes there. What all things he gets to experience. He was born in Bombay. So yeah, another mixed emotion while going there. Anyways, chalo. I'll see you all, and if there's anything, just leave me a message. I'm always available on Instagram, and I'll reply maybe at the end of the day. And my email ID is always there. So yeah, enjoy. Bye bye.